Welcome everyone to our office hours on December 23rd on our BAM pilot. I'm Jen Sharon, NHIA's Chief Operating Officer, and I have today with us Ryan Garst, as well as Bill Noyes and Brandon Scott, who is our guest speaker for today. So we're going to give you some updates on the allocation and data collection. Bill has a couple of words to say on the reimbursement, and we'll also have time for Q&A. So before we get started, I just wanted to share some success story. As Ryan and I were meeting with providers, we talked to Brandon Scott and his group at Community Pharmacy Services in Nebraska, and they had started a program under Nebraska Health similar to our pilot, and we wanted them to be able to come on and share their successes and how they implemented it. And at this point, really, I'm just going to hand it over to Brandon. Brandon, welcome, and thank you for sharing your experiences with us.
Yeah, thanks, Jen. I appreciate the introduction. Thank you. And thanks, everyone, for taking the time out of your busy day to call in. Hopefully, we'll get some good information discussed between everyone here. But as Jen alluded to, my name is Brandon Scott. I'm the lead pharmacist and infusion pharmacy manager here at Community Pharmacy in Gretna, Nebraska. We're primarily a long-term care pharmacy, but we provide compounded sterile infusions for nursing home partners. So that's kind of how we got involved in the Bamlanivimab project. We're active in a lot of organizations locally, statewide, and on a national level. So through these organizations, we were approached by a team at Nebraska Medicine about 4 weeks ago. They're part of the University of Nebraska Medical Center, and they were working with HHS on implementing a pilot program for the distribution of Bamlanivimab throughout the state of Nebraska. And so they approached us mainly to help with the compounding and actual distribution of the product. The nice thing with this project that we've been a part of that has been really successful is the team at Nebraska Medicine. They handle all of the screening and eligibility criteria that through a centralized online survey that they've developed. So the nursing facility staff will go on there. They'll fill out a lot of the clinical information, all the screening information to request the Bamlanivimab for their resident. And then the team at Nebraska Medicine will go through, verify the eligibility. And then at that point, once they're deemed eligible, the Nebraska Medicine team will contact my team to give us the green light on it, and then that's when we kind of take over and help coordinate the logistical aspects of compounding delivery, delivering the supplies, the emergency meds, and obtaining the orders for the actual product. So that's been a really good partnership. I know that the eligibility screening that's a really big portion of this, and it's something that we're super thankful to have that partner to sort of take that off of our team. I know that's been just a great weight off of our shoulders, and that's been a huge part of, I think, why we've been so successful. To date, I think we received product about 10 days ago. We sent out about 130 doses as of today. So we feel like that's been pretty impactful for the residents of Nebraska. We're also partnering. Gretna is part of the Omaha metro area, which is kind of right on the border with Iowa. And so even though this is sort of allocated through Nebraska Medicine, we're able to partner with them to distribute even kind of into western Iowa to help relieve some of that strain on the hospital system here in the Omaha metro area. So it's not just relegated to our Nebraska residents. They've been generous enough to allow that and go across state lines. So that's kind of the overview of our program, Jen. I don't know if that was a decent overview, or if you want me to expand on anything else, or if we want to maybe move on to questions.
Yeah, I think that was great, Brandon. We really appreciate it. Maybe you can just explain a little bit about how the nursing piece works for you guys. I think we talked a little bit about that. That was a little different maybe than some of our other providers.
Yeah, sure. So I definitely realized that being a long-term care pharmacy, we're a little bit different than I think a lot of the members of NHIA, just from being at past conferences. We're not your traditional home infusion pharmacy, going out to individuals, places of residence. We really deal almost exclusively with assisted livings and skilled nursing buildings. So for the Bamlanivimab specifically, and all of our sterile infusions, we compound it here in our clean room, and then it's delivered to the nursing facility, and the nursing facility staff is who actually administers it. So we've had to deal with a little bit of home health on the Bamlanivimab on some of the facilities that we don't normally partner with. That was one piece of the pilot program with Nebraska Medicine. Was, although we're a fairly large player locally in the long-term care business, we don't service every facility in the state. And so as part of this, because Nebraska Medicine covers the whole state, we are sending drug out to facilities that we wouldn't otherwise service or don't normally service. So in those cases, we've had to partner a little bit with home health, but that's been a real minority of the doses that we've sent out. So from that aspect, we've been really lucky that we haven't had to coordinate a lot of home health. The nursing's already on site, taking care of the patient. So that's been one burden that's been really eased on us, I think.
That's great. So I think the other question we've had from other pilot staff or pilot participants is, did you provide the training for the nursing team, or does the skilled nursing facility provide all their training for infused medications?
Yeah, that's a great question. So we do have one nurse on staff here that handles a lot of our internal, or I should say just our internal training with our customers for competencies on infusions and that sort of thing. But also through the partnership with Nebraska Medicine, they have a team of pharmacists and nurses that are able to help walk those facilities through some of the administration pieces with the Bamlanivimab. We do typically, we'll send them off to the Eli Lilly site. I know there's a couple good videos on there about the administration. So because Nebraska is a fairly rural state, some of our smaller facilities don't get a ton of infusions on a regular basis. So although they might have, some pretty experienced RNs, there's a lot of times where, it might be some time since they've actually administered an infusion for a patient. So we've got a couple of resources. We generally point them towards those videos through Eli Lilly. We have a nurse on staff that's able to help walk them through. And then Nebraska Medicine goes over a lot of the other issues when they're screening the patient too.
Great. Thanks a lot. We appreciate your sharing. We're going to keep Brandon on the phone here while the rest of the team does their updates. So please post any questions you might have for Brandon about the success of their program. We're really excited. They'll be working with us in the pilot to help expand into their Iowa area. So, we're super excited to have a group who's had so much success and experience already. So please feel free to post any questions for Brandon at any time, and we'll get to the questions at the end. So Ryan, how about an update on the allocation and data collection?
Sure. So just really quick on allocation for those folks, I know it's been a little bit back and forth, but we did get confirmation late last evening that from ABC that all of the locations that received product or were scheduled to receive products both week 1 and 2 will have their product by end of day tomorrow. So that's a really positive note, because we originally were thinking it could be as late as the week of January 4th. However, they've made tremendous headway, and everyone got a temporary account or whatnot, how they were setting that up if you didn't have an ABC account, and everyone should be receiving their product by end of business tomorrow. So that's a really good piece of the puzzle here, so that folks can get up. And I know many of you have reached out and said you have received product, so that's fantastic. Thank you for letting me know. So in terms of the data collection, we met with HHS last evening, and we were able to streamline some of this. So what is required, and this is primarily to help both HHS and then NHIA really determine your next allocation of drug and how much. So the required information is listed here that we'll need on for every patient and from your facility. So we will need the long-term care facility name, address, city, state, and zip code, as well as a phone number for that facility. We will also need from you the number of doses you have on hand and the number of doses that you infused. And this will be for a reporting period that will run Monday through Sunday every week. So again, that's facility name, address, city, state, zip code, phone number, the number of doses you have on hand, and the number of doses that you infused. And again, that period is Monday through Sunday. We'll have two different options for reporting for you. We are planning on doing a SurveyMonkey that we would release on Fridays. So we won't be doing that this week because many of you are just getting your product. We will be doing that starting next week. And again, with the holiday, we'll probably end up releasing the SurveyMonkey on Thursday versus, which is New Year's Eve versus New Year's Day. And or a data collection tool that'll be Excel. So we need you to select one or the other to report. So some people may find doing the SurveyMonkey is easier, or you find it easier to tabulate as you go and put that on a data Excel form. So you will have both options. You do not need to complete both. You need to pick one or the other for you to report on. And that information will be due by the end of day on Mondays. So again, we'll need that returned to Jen and I, the Excel form by the end of day Monday, or you'll need to complete the SurveyMonkey by the end of day on Mondays. So we can certainly have a couple of questions about that, but I just want to make sure that it's a little bit different than what we've originally discussed. It's a little less information than what we originally thought we were going to need, but this is what we're going to need, and we need to start that reporting next week. Jen, you can go to the next slide. The other piece of data collection is the clinical piece of the puzzle here. And really the purpose for this is to show the effectiveness and clinical outcomes of patients receiving Bamlanivimab in our pilot program. This is not required at this point. And it won't be required per se, but we are asking that you do keep and track this information in your medical record system. Because we may be looking to come back after the new year to do some of this data collection again to show how our home infusion providers have played such an integral role in getting access to the drug to this patient population. So we really are looking at collecting more information, but again, we know everyone's busy. It's the end of the year. And again, we will be looking for this information, but this is all information you really should be documenting as well, just so that you do have it for completeness of the patient and profile. So again, the data elements are the age, the height, the weight, the race, the ethnicity, and the gender, the date of COVID-19 symptom onset and date of positive test, the high risk criteria, the infusion date, the adverse events, and that 7-day follow-up where you're assessing emergency room visits, hospital admissions, or patient expiration within 7 days of the infusion. These are all, many of these pieces of the pie are on our standard order set, so that if you have that order filled out, you'll be able to get that information. But again, these are things that we would like to get collected. Again, not required to report at this time. Just that the previous slide has those data elements. But this is something that, again, we would like to maybe come back to down the road here. And we'll have more information on this after the holidays. We'll create a tool for you to utilize if you want to start collecting that data real time. But again, we don't want to worry about this at this point. We just want to put this out there that this would be the information from a clinical perspective we would be looking at collecting down the road potentially. So Jen, I think you can move on to the next slide. Okay, I'm going to turn it over to Bill really quick. He wants to just mention something that has come up that we mentioned last week, but he just wants to reiterate that because it is a good piece of information. So Bill, I'll turn it over to you.
Sure. So we've been working with the folks at CMS and program integrity to understand the enrollment requirements. If people have questions or issues with claim submission, please let us know so we can help work through those when the time comes. But from an enrollment standpoint, initially there were limitations on service area based on the physical location of the pharmacy, restricted within the state and or MAC, and they have lifted that so that if you're enrolled as a mass immunizer, you enroll your actual physical location, you're able to provide services across the country and submit those claims to the MAC that you are enrolled in through that mass immunizer program. If you are billing through the AB MAC that your pharmacy is enrolled in, not to be confused with the DME MAC, but the AB MAC that your pharmacy is enrolled with, you're able to provide services anywhere in the US. You just have to update your service area information with that MAC, either through PCOS or through filing a addendum to your paper CMS 855B enrollment form. And that's the change that came about 10 days ago that we shared on the call last week, and wanted to share again today. So I think we'll move over to overall questions people have now.
Great, thanks, Bill. So we do have a few questions. I just did want to remind everybody that this webinar is recorded. A link to the recording will be sent to you after the recording is finished. It's also available on our BAM pilot page as well as the presentation. So both of those will be available within the next 24 hours. All right, so this first question is gonna go out to Brandon. Brandon, could you share the following positive COVID testing and within 10 days of symptoms that your response time was for patients to receive the infusion? So do you have an idea of when the positive test was and how long it took the patient to move through the system?
Yeah, good question, Jen, thank you. So Nebraska Medicine, because they're running the pilot, they're the ones that are handling a lot of the data. They're still collecting that. So we don't have a lot of hard data on that. I would say anecdotally, the people that have gotten it more early on in the course of their disease have fared much better. Overall, just from the data that we've collected internally, about 5% of people have been hospitalized after receiving the infusion, but one of those was due to a UTI, which was completely unrelated to the COVID diagnosis. But overall, just from talking to the nurses after infusion, they've really been impressed with the turnaround that folks have had, particularly when they've gotten it early. So the earlier the better, obviously.
Great, thank you. So Bill, we may not have the answer to this question and we might have to follow up with folks, but do you have any information on the pharmacist professional fee scheduled ASCP has recommended the reimbursement of $147.68 per therapy? And how should this be billed? Do we have information on that, Bill?
We do not. We were just talking about that prior to the call, and we'll be following up with ASCP. So I've got zero information, just learned about it this morning.
Okay, perfect. All right, next one. If our residents receive the vaccine, what is the role of BAM? Ryan, did you want to take this? I think we had a little bit of we had a question about this last week, but would you like to take this part?
Yes. So at this point, we don't have any information in regards to, I think Bamlanivimab will still have a role. Not everyone in this, what I'm trying to say is they're still rolling out their vaccine process to the skilled nursing facilities. And so that's going to take some time. What the question that we did have, so I feel like there's still going to be plenty of opportunity for BAM, depending on where you're located and how quick the facilities in your area that you may service are going to be able to get access and then get patients administered with the vaccine. Conversely, the other question that we don't really have information about is if a patient was to get a dose of Bamlanivimab and then get the vaccine, that came up. We don't really know if there's a time period between administration of the Bamlanivimab and then giving a vaccine. But at this point, obviously as more nursing home residents would get vaccine, the use of BAM may go down. But again, as we've seen with some of the distribution channels and things like that, and the number of doses are still limited at this time, even with Moderna getting their EUA late last week. There's still a role for the product in this short period of time as they roll out the vaccine to the facilities, is the best we can say.
Great, thanks, Ryan. And if we have any clarification about that, we will certainly get that information out to folks sooner rather than later. And communication is a two-way street. So if you hear something about that as well, please let us know and we're happy to investigate. So I think that was our last question for today. Another big thank you to Brandon for sharing your success, and we're so glad that you've been able to help this group of residents who clearly has been impacted by the COVID virus so heavily. NHIA would also like to wish everyone a peaceful holiday season and a happy, healthy new year in 2021. Thank you to all of our pilot participants, and we look forward to chatting with you next week. Thank you and have a great day.